Hi, I'm Mairead Painter, the State Long-Term Care Ombudsman here in Connecticut. I'm here this evening with Barbara Cass from the Department of Public Health and Kim Prisniak from the Department of Public Health to talk to everybody about our essential caregivers bill that passed, and the information has gone out and the training to our long-term care facilities has happened. So we wanted to take this opportunity to present to you all and ensure that you had the information related to how to move this forward in your long-term care community. So Barbara and Kim, I don't know if you guys want to introduce yourselves.
Kim, do you want to go first?
Hi, good evening, everyone. I'm Kim Prisniak. I'm the Public Health Services Manager at the Facility Licensing and Investigation Section at the Department of Public Health.
Good evening, everyone. I'm Barbara Cass. I am the retired branch chief of healthcare quality and safety at DPH, and I am back at DPH as a temporary worker retiree. Yes, that is a thing. So thank you all for joining us tonight.
And we're very glad that you are here to join us, Barbara. And with this, I'm going to share my screen and go over some of the PowerPoints or all of the PowerPoints that we did with the nursing homes, just so that you all have the same information and know what to expect. Of course, I need to make sure I do it correctly. You know?
Perfect.
Okay, so I will do this. Okay. So this is the training for the statewide visitation for residents of long-term care facilities, which incorporates the essential caregivers or essential support persons bill. So Barbara, I don't know if you want to start walking through and covering this, and we can go back and forth.
Thank you. Thanks, Grace. And this is actually the same training PowerPoint that we did do for the long-term care industry last week. We had a very large amount of attendees, which was very good. And we did share the slide deck with the providers after. Several providers did reach out to us, and this was sent to them so that they could train their staff and start implementing this policy if they had not already done. So an act concerning essential support persons is a public act. It was Public Act 21-71, and it did have three parts to it. It was a public act that there was lots of discussion before it was even codified into law. And the real impetus for this bill was a result of the pandemic. And during the pandemic, we know that was very hard for family members and for residents. Many sacrifices were made at many levels. There was a ban on visitation that we believe that did help mitigate some of the spread of COVID-19, but we also acknowledge that it did have very significant, in some cases, unintended implications. So fast forward to 2021, and we do have Public Act 21-71, three parts, as I mentioned. And the first part of the bill does allow a long-term care facility resident or their representative. It did include nursing homes and managed residential communities. You may recall that as we navigated through COVID, we defined long-term care facilities as nursing homes and managed residential communities, or MRCs. And it does provide that, again, a nursing home resident or their representative may designate an essential support person and a secondary support person who may visit the resident despite any visitation restrictions that have been imposed on visitation as a result of, for an example, a pandemic or some other incident that would limit visitation. Next slide, please, Marie. The next part, again, I mentioned it was two parts, and if we could flip through to the second one, it requires the Department of Public Health, and specifically the commissioner, to establish a statewide policy for visitation with long-term care residents. This statewide policy for visitation would be imposed implemented in the event of a declared public health emergency. We had lots of meetings here at DPH. Maraith was part of our work group to develop the statewide visitation policy. And we also had representatives from the Family Council. So I'll talk a little bit more about that, but we have developed the statewide visitation. It is posted on our website. If any of you need it, I can certainly send me an email and I will send you the link. But if you just Google DPH blast faxes, it will come up, and in a subsequent slide, we will see actually the blast fax. Next slide, please. And the third part of the bill was it directed that under the existing law, the state long-term care ombudsman's duties include services that protect the health, safety, welfare, and rights of long-term care facility residents. This public act expanded the role to include services designed that impact the socialization, visitation, and the role of the essential support persons on residents in a nursing home. Next slide, please. So what came next? The Public Act was codified. It required, oh no, but wait, this is where you're going to talk a little bit about the national work that's being done. And again, I do want to call out and celebrate that Connecticut has been actively engaged in this, not only Maraith and her office, but representatives from your Family Council have been active in this. So Maraith, I'll pass that over to you.
Thank you. Absolutely. So HR 3733, the Essential Caregivers Act of 2021. We here in Connecticut are the only state, I believe, that have all of our members of Congress who have signed on in support of this bill. And yes, we have an amazing statewide family council, as well as individual family councils, residents, and family members who have been advocating to ensure that this bill moves forward. It's been a little bit of a lesson in legislation where things don't always move forward the first time, and we've been pushing this, and we have a few family members that just their level of tenacity, calling all around the country, making appointments, and ensuring that individuals know what the outcome was of having individual residents spend so much time alone and without their essential supports. As we're talking about this, you're going to hear that this is under a visitation bill, but we all acknowledge that essential support people and essential caregivers are different than a visitor, right? It's separate and apart from someone who comes to visit a resident. These are individuals that are providing an additional level of support to the resident. So I just wanted to acknowledge that, and that yes, we worked on this, and we've worked on the federal bill and had support from the Department of Public Health, as well as both of our nursing home agencies, family members, resident councils, and family councils. Thank you, Barbara. I'll go to the next one for you here.
And you know what, before we go any further, I just want to note, just our luck, the live is going to end in about 1 minute. So I think what we'll do is we'll stop there. We'll come back live in just about a minute. So everybody tuning in, we'll be right back. See you in a minute.
Welcome back. We are so sorry about that. We're having a little bit of a glitch with our Zoom this evening, but we're going to pick up right where we left off related to the blast fax. So Barbara, I'll turn it back to you.
Thank you, Marie. And waiting to see the PowerPoint, or do I not have it?
Oh, never mind. I will share that. Hold on 1 second. I thought I was already back up. Goodness gracious. Let's try this. Okay.
And for those who are tuning in, I did put a link to the blast fax in the chat.
Oh, thank you. Thank you.
Wonderful. Thank you.
Could we go back to the previous slide, Marie? I just want to celebrate all the work that was done as a result of the collaboration. This was a big lift. We were still, all of us were still working with COVID, and we carved out time. This was a priority for the department. And again, this is where collaboration worked amazingly well. We worked with the long-term care ombudsman, DPH, the two trade associations, CAHCF, Leading Age, and representatives from the Family Council. We actually had, and I say physical representation, but we were doing Teams meetings and Zoom meetings at that time. But we had the great value of having Amy Bardini and Liz Stern there to represent your voice, which was critical. They were compelling, and their comments were so positive. This work did move quick, well, not as quickly as we all would have wanted it to, but it moved. And again, we are proud to say that we have implemented this and we have a statewide policy. So as we've all indicated, it was sent out in a blast fax, which we will see on our next slide. Dan, thank you for the link. So it is blast fax 2022-19. And it does give or provide a link to the Public Act, as you will note in the body of the blast fax. And it also included a copy of what the statewide visitation policies and procedures were. And those are in the next slide, please. So in that blast fax document, you will see the entire document that has been approved by the commissioner. It's, again, a multidisciplinary, multi-collaborative approach, and we are proud and celebrate that we have implemented this in Connecticut. Next couple of slides are going to go through excerpts or pieces of the visitation policy to give you all a clearer understanding of what the expectations are of the nursing home and what is going to be provided to residents and the responsible party. Next slide, please.
And Barbara, to that point, to your point about the collaboration, I do want to acknowledge that nationally, we are known for the best practice of collaboration and having interagency discussions, as well as talking with the industry. And really, I think more than any state, moving forward with engaging residents and family members in conversations so that we are doing this with them. So I want to thank you all for your participation and support in that with us, because that's not something that we see nationally, and we've appreciated DPH's support in that.
So again, this is a summary of the statewide visitation policy, and the Public Act does require the DPH commissioner to establish the statewide policy, which is again included and posted on the blast fax website. It does include nursing homes and MRCs, and it does require and incorporate a resident's need for health, safety, and well-being, and including essential support provided by an essential support person. So this is a very important statement. It acknowledges the value that that essential support person has to the resident, has to the resident's care plan, and their overall psychosocial, spiritual, mental, and physical well-being, which is one of the requirements that nursing homes have to comply with for all residents that are in their care. Next slide, please. The resident or the resident's responsible party designates the person who may visit with the residents in accordance with the rules that are established in that visitation policy. It should be reflected in the resident's person-centered care plan. So the resident or the resident's responsible party should have been actively engaged in that process. We did, to a granular level, describe what that essential support means, and it does include assistance with activities of daily living and physical, emotional, psychosocial, and socialization support. We heard from many families during COVID-19 how much that visitation ban did impact residents. Many family members go in and, as it does indicate on this slide, provide assistance with ADLs. We heard that Residents eat better with family members. So this just validates how important that essential support person is. It does allow the resident or their representative to designate a secondary essential support person, and that person and or the secondary support person may visit the resident despite general visitation restrictions that may be imposed under a statewide visitation policy or a ban or prohibition on visitation. Next slide, please. So visitation. The long-term care facility shall have a policy in place to allow for visitation to take place in the facility. And the next bullet describes the elements that must be included in that policy. It must include the resident's right to visitation and the reasons for that. I won't go through them all, but this just underscores how important that policy is. It does include any individual hired by the resident or the resident's representative to provide personal care or any ancillary or additional services that that resident must need that has been assessed. And that person shall follow the same policies and procedures as facility staff. Important to underscore from this slide that the essential or secondary support person, essential support person, must follow all protocols implemented by the facility for visitation. So that's specific. A specific example of that is if all visitors need to wear personal protective equipment, or if they need to wear eye shields, that must be followed. And the facility must inform the essential support person of that policy. Next slide, please. This speaks to the resident's right to elect a primary and a secondary essential support person. They can, again, elect primary and secondary as part of their person-centered plans of care. I know that Maraith and her office have spoken a great deal throughout COVID about person-centered plans of care. And that's critically important to this. A resident should have the opportunity and the right to determine who that essential support person is. And again, as we've noted in the beginning, that those primary and secondary designated individuals are not to be considered visitors. They are essential to that person's plan of care. If a resident is unable to select a primary and secondary essential support person, the resident's representative can make that designation. And the resident may appoint their primary or secondary essential support person to provide input in the development, implementation, or any revisions to the resident's comprehensive care plan. Next slide, please. So if a public health and preparedness emergency has been declared, and that guidance restricts access to the residents, the primary or secondary essential support person shall have access to the resident not less than 12 hours per day, provided, and this is critically important, provided such access shall not endanger the health or safety of the resident or other residents. And again, as we've noted, they do have to follow any applicable state or federal requirements and any visitation guidance that is in place at the time. They must follow the same safety and infection control protocols and any other safety measures that have been determined or put in place by the facility for their facility staff. And no individual may be designated a primary or secondary essential support person unless they can adhere to the facility's policies or procedures that are in place. Next slide, please. So again, no primary or secondary essential support person should be or shall be denied access unless the facility demonstrates that that individual poses a risk or a danger to the health or safety of the residents or other residents. If that access has been denied, the long-term care facility shall, and that's not a may or could, they shall provide written justification to the primary or secondary essential support person electronically or in writing via certified mail within 24 hours of the denial of access. And the justification has to include the reason for the denial. If that person has been denied, again, primary or secondary support person, they may also submit information included with the denial by the facility to the long-term care ombudsman's program. And they also may contact the Department of Public Health and submit a complaint. And upon receipt of such complaint, the Department of Public Health may initiate a complaint investigation. Next slide, please. Okay, that brings us to questions. And before we do get to questions, I just wanted to share one of the questions that we received from the provider community. A nursing home did submit a question that the legislation does not provide, while we have an implementation date for the essential support person program, it doesn't indicate that effective or by such date, all residents shall have designated a primary and secondary support person. So we've been sharing with nursing homes that, again, as we've discussed through the slides, that this should be done through a person-centered care plan meeting. It has to be about the resident's needs, and resident decision-making or the resident's representative is important here. We have indicated that this should be done at the next care planning meeting, which typically we would get all of them done in the next 3 months because care planning meetings should be conducted quarterly. However, we have indicated to the industry that if a family member had come to the facility and indicated they would like to start that process right now, the facility should make every effort possible to conduct or initiate that process so that that designation could be honored. So I will stop there, look to my colleagues to see if there's anything they would like to add.
I think that was a wonderful overview, and thank you so much. I want to just go over what I'm reading here in the thread. So Amy from the Family Council wanted to say that they're so appreciative of this training, and she put, wow, go CT. So thank you both. Doreen, I saw you had a question. Doreen's a resident and said that gave her name, but I don't see the rest of your question, Doreen, so feel free to finish that. And it must have been a pretty good overview. I don't really see many questions in the thread. I think we've talked about this a lot. We've talked about it here on Facebook Live, and people have anticipated it coming. I know that they really appreciated the fact that the information went out to the nursing homes so that they knew what they were asking for and about. And then Dan did throw up the thread and the guidance in the thread, I should say. So that's it. What I'll encourage people to do is if you think of a question or you have something that comes up related to this, you can always feel free to send it to our email, and we will talk with the Department of Public Health and get an answer for you and get it posted. Deb, are new residents going into nursing homes and families being made aware of this? So this will be part of the care plan process moving forward, and will be something that you all are looking at on survey, correct, Barbara and Kim?
Yes, that's correct. And we meet with the industry quarterly. And as issues come up, we are happy to share with the industry where there may be some identified challenges or gaps. It's important for all of us that this work. it's important for all of us that we continue to the extent possible, maintain, again, a level of psychosocial, spiritual, and physical well-being for all the residents in nursing homes. And this is an important tool for us to do that. So if there are challenges that you're seeing, please let us know. As we noted on the last slide, there's due process for a person who may be denied access. And there also is a complaint process. I think all of us hope we never, ever, ever have to implement a statewide visitation policy. But if that should happen, Connecticut's prepared. So again, to Amy's point, yay for all of us for doing this work.
Absolutely. And for the partnership. And to that point, we have a message from out of state that says, how do we get this information to other states where we don't have the cooperation and help either from or between their public health and ombudsman? I'll say for myself, I have been talking with my peers about how important it is to build relationships and understand where we're not always going to agree on everything, but it's important to hear each agency, what their responsibilities are, and try to come up with a way to get to the middle together. And I think the more that states work on that, the more successful they'll be in this area. So we have been talking about that in the ombudsman world. And then we do collaborate a lot with CMS, who's the partner with so we go to the Administration for Community Living under HHS nationally. DPH is under CMS nationally, but we're under the same heading. We have a lot of the same, almost all the same goals, which is that residents have the best quality of life. So Barbara and Kim, I'll ask you from your point of view, how you share that with partners and discuss what we're doing here.
So it's Kim. Thank you for that. We do have we have regional calls, which are within our New England states, and sometimes these subjects come up, and we can certainly pass that on. And not only that, but we also do have the national calls where all of the states are involved. So if any subject comes up in regards to the relationship, and many times our colleagues from other states reach out to us, and they may do a poll to see what our relationships are with you and your group may read, or how they could enhance that kind of to get a global understanding of what's going on nationally as well.
And Connecticut likes to celebrate that the work that we, to Maria's earlier point, the work that we get to do collaboratively. We know that we get better work, more work done when we do it together. So those are achievements and successes that we do like to share with other states. And as Maria has indicated, it really is a best practice that, again, the more we can do together, the better the work product will be. So we do have the opportunity, as Kim has noted, to speak about that work. And we also attend national conferences, as Maria does, and share the best practices that we are doing. You can also, we do point out our blast faxes. Those are in the public domain, and certainly Public Act 21-17 is in the public domain. And we may see other work that's being done that's been started federally, and that will have that trickle or ripple throughout the country as well. The impact there will be nationally.
Absolutely. And actually, Barbara and Kim don't even know this yet, but I did. So we have a national conference every year, and we've talked about it. But one of the things that I've asked my national partners for is to really promote the connections and how to help encourage other ombudsmen to really have open dialogue and communication with their state agencies. And I've used our state partners as an example for that. So hopefully they'll get some recognition at the national level for that. From Liz, she said, this is the time for us to thank Barbara and her department and the long-term care ombudsman program for our support. My only concern is an echo of what I just heard, broadcasting and supporting this bill. The next step is ongoing education, and Connecticut advocates are ready. So she's talking about at the national level and helping people understand why this is so important, I believe. The next question says, does DPH have enough staff to enforce these rules? It seems that there's challenges related to the basic rules issues with cleanliness and etc. So are there enough staff to enforce these rules through DPH?
Yes, we have enough staff. And when we presented this, we also encouraged, I know the question came up about new admissions. So we said that that's a good starting point as well, not only with the resident care conferences, but on admission. So that is something that we look at when we go in for our regular surveys, that you'll see the survey team going in. And also if there happen to be a separate survey related to any complaint investigations, we can look at that as well.
And lots of work is being done at DPH. I know there's been lots of information that has been shared through the media that on July 1st, there were lots of retirements at state service. But we are happy to say that at DPH, we have received approval to refill all of our positions, and recruitment is actively happening. We are working on our training plan. Included in our training plan are all the public acts. We just did a training last week with our staff, our whole staff, on this very act. So our staff are primed up and they're ready to go.
Great. And to that point, we are also working to ensure that all of the roles within our program are filled. I know that lately it has been a little more challenging, and our timelines have gone out a little bit related to having open regions, but we're actively filling those as well and moving forward, excited for the next steps and other work we can get done. Yes, the PowerPoint will be shared. It will be shared here on our Facebook page as well as on our website. And then the last question, certain states are not even entertaining essential support persons either on the state or federal level, or legislation or regulatory. Also, kudos to Connecticut. Thank you, Karen. And, we are going to keep reaching out to those other states. I know I've talked with your state, and we'll continue to try to support you all and get you information as needed. I want to thank everybody for joining us tonight, but a special thank you to Barbara and Kim for being here, and Dan Beam for assisting in the background and helping us out so much. I'm sorry for the little blip at the beginning. But I'll give you both a chance to say good evening to everyone as well.
So I'll go first. Everyone knows I never have a problem talking. So thank you all. Thank you for spotlighting the issues with this. We are always eager to collaborate with our partners, but particularly residents and families. Your voice is important to us. You live this experience every day of your lives. So what you do say does matter. And Liz and Amy, thank you. I know it wasn't easy. A lot of hard work, so we are grateful to you. And again, to Mag and Matt as well from the trade associations. They were great as well. So we had great partners on this. Thank you all. Kim, I'll pass to you. And Dan, thank you for being our MC and our guy behind the screen.
Our tech support behind the screen. Thank you. Good night, everybody. We're happy to have had this opportunity to share this information with you, and we look forward to continuing to work to improve the quality of the care of the residents in the long-term care facilities.
Wonderful. And there's a request that you all maybe take this back for Hartford and let your commissioner know that this is an opportunity for your commissioner to shine. They're very thankful to the commissioner. And if there is an opportunity to kind of shout it from the rooftops about what Connecticut's doing, we will absolutely take that. So thank you all. And I hope you have a great night. We'll talk to you soon.
Bye, everyone. Stay well. Thank you.